Welcome back to Fox 43 AM Live. Join us now is Cassidy Moreau, veterinary social worker at the Veterinary Health Center. Good morning.
Good morning.
Happy to have you here. I'm excited to learn a little bit more about what you do. I want to start out with really what is a veterinary social worker, and what does that role entail at the Veterinary Health Center?
Yeah, so great question. It's one I get a lot, actually. So veterinary social work is actually a newer section of social work, if you will. About 2002 is when it kind of came on board.
Okay.
It started University of Tennessee. So if you think about our veterinary professionals are taking care of the patients and the medical need for the animals, and I'm tending to the human need in that relationship.
Okay,
so,
wonderful.
Yeah, the human end of the leash, if you will. Yeah.
Okay,
Yeah.
so yeah, how does your work, I guess, help both the veterinary professionals and the clients then? Where do you bridge the gap?
Yeah, so it's actually, I have a unique position at the Veterinary Health Center because I'm tending to the veterinary professionals. So I am helping with the intentional well-being, the mental health support for our professionals. So that's our faculty, staff, and our fourth-year clinical students, even our interns, our house officers there in the hospital. But then I'm also helping with the clients who are coming in who maybe need some grief and bereavement support for loss of animals, connection to resources, those types of things. And when I'm able to step in and help our clients with those things, it takes that off the plate of our veterinary professionals.
Yes.
And it kind of helps them focus on that patient care piece.
No, I love that. I love that kind of diversifying really of roles, because it can't be easy, especially talking to more grieving pet owners. I would be a mess when that day comes, unfortunately.
Yes, it's hard.
I'm curious, what inspired you to pursue this career path? You're the first veterinary social worker at the K-State College of Veterinary.
Yeah.
What brought you to this role?
Yeah, which is super exciting. I kind of think of it as a dream job. But it actually started with just an invitation. Dr. Ron Orchard teaches in the shelter medicine program and our community outreach. So he's working with students that are going out into our communities and working with more disenfranchised populations, specifically those that are experiencing homelessness and unhoused. And that invitation was to come talk to the students, because at the time I was working with people that were experiencing homelessness. And just talking to the students about what those experiences and circumstances are like for individuals. And then I discovered that veterinary social work was indeed a thing. And through all the different type of social work jobs I've had, the human-animal bond was always a common theme in all of those things, and something that I used to really connect with my clients and my folks that I worked with. And so just to be able to develop those skills and how to support veterinary professionals as well was something that I knew I really wanted to do. And so establishing those services at the Veterinary Health Center, I hope that we can grow that service to be able to serve our community and more clients and give them access to those supports.
I love it. And so you mentioned that you see that human-animal connectivity every day. Yeah, what's a day in the life for you here at the hospital? What are the challenges you end up coming up, and how do you beat them? Yeah,
I think one of the biggest challenges is working with individuals that don't have access to care. And we get calls from folks from all over. It's not just in the Kansas area, not even Manhattan. We get calls from Oklahoma, Nebraska, a lot of individuals that are looking for certain services for their animals. And because veterinary social work is such a newer section of social work, we really are working to build those resources to be able to serve lots of individuals and give them access to care, whether that's in our community. If they're local in Manhattan, it's a little easier than if they're calling from Nebraska. But we really want to be able to build those resources. I have a great network. We actually have an international veterinary social work organization, and I'm really thankful for that, because it kind of helps connect folks to resources around the country.
That's great. And real fast, I'm curious, have you seen the impact your role has had on the community?
Absolutely. I've definitely seen it with certain clients that are coming in that have unfortunate circumstances, and because I'm there and able to offer connection to resources, and I've been able to have a great partnership with the Crisis Center in Manhattan, and that's been able, some of our clients that have come in and had unfortunate circumstances, and connecting them directly to the services they need.
That's great. Well, it sounds like you're filling a great role over the veterinary hospital, and again, for pet parents like me, I'm glad there's someone there to help us through some of the rougher patches of taking care of our little guys.
Yeah, and we do have a grief and support group at the Veterinary Health Center called Paws of Comfort, and we meet once a month to help folks that are going through those experiences.
I know. Some of those days are going to be hard,
yes,
but that's great
absolutely.
that there's support out there like you guys.
Yeah.
Well, Cassidy, thank you so much for joining us this morning. It's been such a pleasure chatting with you.
Yeah, thanks for having me.
And of course, everybody, if you also want to learn more, you can visit ksvhc.org.